7 exercises used by the Japanese to activate the second heart and eliminate high blood pressure after 50. Swollen legs, fatigue without apparent reason, tingling in the feet. These signs you may be ignoring are your body crying out for help. A study published in the Journal of the American Heart Association revealed that sedentary adults over 50 have up to 73% higher risk of developing deep vein thrombosis and serious cardiovascular events. The problem, in most cases, is not in the heart, but in the legs. When circulation fails, blood stagnates, thickens, and becomes a real threat. The Japanese have known this for decades, and it is no coincidence that they are among the peoples with the lowest rates of cardiovascular disease and high blood pressure in the world. Their secret lies in the daily and conscious movement of the legs, what they call activating the second heart. That is why today you will see 7 exercises used by the Japanese to reactivate this pump, cleanse the arteries, and regain control of your blood pressure even after 50 or 60 years of age. Before we begin, please tell us through the comments your name and the city from which you are watching our content. We would love to know. Exercise number 7, standing march. There is an exercise practiced in rehabilitation centers in Japan that seems too simple to be taken seriously, but which Japanese doctors and physical therapists frequently prescribe to people over 50 with compromised circulation. The standing march consists of marching in place at a steady rhythm, lifting the knees alternately while the arms move in opposition to the legs, as if you were actually walking, but without moving from the spot. What makes this exercise particularly valuable is its effect on arterial elasticity. When you march, the muscular contractions of the thighs and calves create pressure variations inside the blood vessels. This rhythmic friction of blood against the artery walls stimulates the production of nitric oxide by the endothelial cells, the inner lining of the vessels. Nitric oxide is a natural vasodilator. It relaxes the arteries, reduces peripheral vascular resistance, and, as a direct consequence, lowers blood pressure. The main muscle groups recruited are the gastrocnemius, the soleus, the quadriceps, and the iliopsoas. To perform it correctly, position your feet at hip width and start the movement by lifting one knee until the thigh is nearly parallel to the floor. Maintain a rhythm of approximately 1 step per second and move the arms alternately with the elbows bent at approximately 90 degrees. The core should be lightly engaged and the spine upright. Those with balance difficulties can hold the back of a chair for support, and the effectiveness remains. The main errors to avoid are lifting the knee too high and straining the lower back, landing the foot with a free-falling heel creating joint impact, and swinging the arms crossed in front of the body, which reduces cardiac output. Perform 2 to 3 sets of 60 seconds with rest intervals of 30 to 45 seconds. Those just starting out can reduce to 30 seconds and gradually increase. The main contraindication is for those with an acute knee or hip injury. Exercise number 6, calf raises. If there is one muscle that deserves more attention than it receives after age 50, that muscle is the calf. Called the second heart by circulation specialists, it performs a function that goes far beyond aesthetics. Every time the calf contracts, it compresses the deep veins of the legs, creating pressure that pushes venous blood upward, back toward the heart, defying gravity. Without this mechanism working well, blood tends to accumulate in the lower limbs, causing swelling, heaviness, tingling, and, in the long term, directly contributing to elevated blood pressure. The calf is composed predominantly of slow-twitch muscle fibers, meaning it responds better to sets with more repetitions and greater time under tension. This is exactly what calf raises provide. The exercise is performed standing with the feet parallel at hip width. Raise the heels as high as possible, achieving a full contraction at the top of the movement, then lower slowly without letting the heels strike the floor between repetitions. A valuable tip is to perform the exercise on the edge of a step, as this allows the heel to drop below the level of the feet, increasing the range of motion and recruiting far more fibers of the gastrocnemius and soleus. Varying the foot position between parallel, slightly turned out, and slightly turned in ensures all portions of the calf are worked. A well-developed calf also improves balance and proprioception, critical factors in preventing falls after age 50. The main errors to avoid are rising only halfway without achieving the full contraction, lowering too quickly and losing control of the eccentric phase, and allowing the ankles to roll inward during the movement. Perform 3 to 4 sets of 15 to 20 repetitions. Those with active Achilles tendinitis should consult a professional before including this exercise in their routine. Exercise number 5, wall calf stretch. This is the second consecutive exercise focused on the calves, and it is no coincidence. Shortened muscles do not contract with full force force, and a shortened calf reduces both the stride length and the efficiency of the venous pump. It is like trying to fill a balloon with a knot at the end. The pressure exists, but the result is limited. The wall-calf stretch prepares and loosens the muscle, enhancing all the other leg exercises you perform afterward. To perform it, stand close to a wall, place your palms against it at shoulder height, and step one foot forward while the other remains extended behind. The back foot should be completely flat on the floor with the heel firmly planted without lifting. Keep the back leg straight and gently push the hips forward and downward until you feel the stretch in the back calf. Hold for 30 seconds on each side, breathing continuously. To deepen the stimulus, you can repeat with a slight bend in the back knee, which stretches the soleus more specifically, the deepest muscle of the calf and responsible for much of the venous pump. Rigid and shortened muscles compress the vascular structures around them, hindering venous return even at rest. Stretching regularly reduces this mechanical resistance and facilitates blood flow passively. The main errors to avoid are lifting the heel of the back foot, which completely eliminates the stimulus on the gastrocnemius, and leaning the torso forward instead of keeping the spine aligned, which transfers tension to the lower back. Perform 2 sets of 30 seconds on each leg, preferably before the calf raise exercises. People with a recent Achilles tendon rupture or acute plantar fasciitis should avoid this movement until cleared by a medical professional. Before we continue, do not forget to subscribe to the channel and activate the notification bell. Having constant access to science-based information is what will help you progress with health over the long term in the world of exercise. Exercise number 4, Viparita Karani. Originating from Indian yoga and widely adopted in cardiovascular rehabilitation programs in Japan, Viparita Karani is one of the most intelligent positions you can include in your routine if the goal is to improve circulation with the minimum possible effort. The name may sound complicated, but the position is extremely simple. You lie on the floor and rest your legs vertically against the wall, forming an angle of approximately 90 degrees between the torso and the legs, like the letter L. You remain in this position for 5 to 10 minutes. What happens in that time is remarkable. Gravity, which normally works against circulation in the legs throughout the day, begins to work in your favor. The blood and lymphatic fluid that accumulated in the lower limbs during hours of standing or sitting begins to drain back to the heart without any muscular effort. This is why this exercise is particularly recommended for those who feel swollen feet and ankles at the end of the day. A study published in the European Journal of Applied Physiology demonstrated that partial inversion postures, such as Viparita Karani, significantly reduce pressure in the veins of the legs and improve central venous return, relieving the load on the right ventricle of the heart. To perform it correctly, sit close to the wall, lie on your side, and roll your body into position, placing the glutes as close to the wall as possible. Extend the legs upward and rest them completely against the wall. The arms can rest at the sides of the body with the palms facing upward, which promotes relaxation of the chest muscles and facilitates diaphragmatic breathing. If you feel discomfort in the lower back, place a folded towel under the sacrum to cushion the pressure. The main errors to avoid are keeping the legs slightly bent due to lack of flexibility, which reduces the gravitational effect, and using a high pillow under the head, which can create tension in the neck. There are no sets or repetitions here. The recommendation is to remain for 5 to 10 minutes once a day, preferably in the afternoon or evening after a long period of standing or sitting. The most important contraindication is for people with glaucoma or elevated intracranial pressure, as the inverted position can increase pressure in the eyes and head. Those with severe hypertension should also consult a doctor before adopting this position. Exercise number 3, foot flexion and extension. Discreet, silent, and extraordinarily effective. Foot flexion and extension is the type of exercise you can do seated in any chair anywhere, and that aviation physicians prescribe on all long flights precisely to prevent deep vein thrombosis. And if it works at 30,000 feet inside an aircraft, it also works on your couch, at the office, and in the doctor's waiting room. The movement consists of alternating between pointing the feet downward, moving the toes away from the body in plantar flexion, and pulling them upward toward the shin in dorsiflexion. This continuous cycle of contraction and relaxation of the calf muscles and tibialis anterior creates a kind of pumping action that moves venous blood from the extremities toward the heart. The main muscles recruited are the gastrocnemius, the soleus, and the tibialis anterior, the same ones involved in walking, which means you are simulating some of the circulatory benefits of walking without having to leave your seat. To perform it correctly, sit with your legs slightly extended in front of you or with your feet resting on the floor, and perform the movement in a controlled and rhythmic rhythmic manner without rushing. Each complete cycle should last approximately 2 to 3 seconds. You can perform the movement with both feet simultaneously or alternately, with the alternate version requiring slightly more coordination and activating the ankle stabilizers more intensely. An effective variation is to add small ankle rotations clockwise and then counterclockwise between sets, which activates the stabilizing musculature around the joint and further improves local circulation. The main errors to avoid are performing the movement too quickly without control, which reduces time under tension and the efficiency of the pumping action, and moving only the toes instead of mobilizing the entire foot from the ankle, which drastically limits the compression of the plantar venous plexus. Performing this while watching television, during meetings, or at any moment of prolonged inactivity is more than enough to reap the benefits. Perform 2 to 3 sets of 20 to 30 complete repetitions, which can be distributed throughout the day whenever you remain seated for extended periods. There are no relevant contraindications for this exercise. Even people with quite limited mobility can perform it without difficulty, making it one of the most accessible and inclusive exercises on this list. Exercise number 2, glute bridge. The gluteus maximus is the largest muscle in the human body, and most people have no idea of this. This fact completely changes the way you should think about leg training after age 50, because a large and well-stimulated muscle generates circulatory effects proportional to its size. The glute bridge is one of the most complete exercises for activating this musculature, while at the same time promoting efficient compression of the deep veins of the pelvis, one of the most critical regions of blood stagnation in the human body. When blood becomes pooled in the pelvic region, venous pressure increases, circulation in the legs worsens, and the heart must work harder to maintain adequate flow. To perform it correctly, lie on your back with your knees bent and your feet flat on the floor at hip width. Lightly engage the core and push the hips upward in a controlled manner until a straight line is formed between the shoulders, the hips, and the knees. At the top of the movement, make an intentional contraction of the gluteus maximus and hold for 2 to 3 seconds before slowly lowering. Do not let the hips touch the floor completely between repetitions in order to maintain muscular tension. In addition to the glutes, the exercise recruits the hamstrings, the spinal erectors, and the core stabilizers, functioning as a complete posterior chain exercise. One error I see many people make is hyperextending the lower back at the top of the movement instead of using the glute to lift the hips. Another frequent error is positioning the feet too far from the body, transferring the effort to the hamstrings and reducing the recruitment of the gluteus maximus. Perform 3 to 4 sets of 12 to 15 repetitions, with rest intervals of 30 to 45 seconds. Those with acute lower back pain or a recent hip replacement should consult a professional before including this exercise. Exercise number 1, Nordic walking. Nordic walking was born among Scandinavian skiers who wanted to maintain their physical conditioning in the summer when the snow disappeared and the skis stayed in storage. Over time, they realized that walking with poles was not merely a seasonal adaptation, but rather a superior form of walking for cardiovascular health. Today, it is widely practiced in Japan, Finland, and throughout Europe by active older adults, and the reasons are supported by consistent data. A study published in the Journal of Rehabilitation Medicine demonstrated that Nordic walking increases cardiac output by up to 46% compared to conventional walking, without increasing impact on the knee and ankle joints. This happens because the poles force the arms, shoulders, and upper trunk muscles to work actively, transforming what would be a lower body exercise into a full body movement. The result is a much greater cardiovascular demand, lower blood pressure over time, and significantly more efficient circulation. To perform it correctly, the poles should be adjusted to the ideal height, approximately between 66 and 68% of your height. Plant the pole on the ground slightly in front of and to the side of the body while the opposite foot advances. The arm actively pushes the pole backward during the stride, and the movement should be fluid and rhythmic. Keep the spine upright, the core lightly engaged, and the gaze forward. The main errors to avoid are using the poles only as passive support without actively pushing them backward, which eliminates the upper body benefit, and shortening the stride too much out of excessive caution, reducing energy expenditure and the circulatory stimulus. Perform sessions of 20 to 40 minutes 3 to 5 times per week. Beginners can start with 15 minutes and gradually increase. People with severe balance impairment should begin with professional supervision to ensure correct technique from the start. Now that you know all 7 exercises, we still have a bonus that will close this cycle in a surprising way. Bonus exercise 4-7-8 breathing. You have just seen seen 7 exercises that work the circulatory system from the outside in, activating muscles, compressing veins, draining venous return. But there is a path from the inside out that most people completely ignore: controlled breathing. And the technique we will see now has a direct impact on blood pressure through a mechanism that few people expect: the vagus nerve. The vagus nerve is the main component of the parasympathetic nervous system, responsible for slowing the heart, relaxing blood vessels, and reducing blood pressure. Every time you exhale slowly and for a prolonged duration, you activate this nerve and send your cardiovascular system a clear message: you can relax. The 4-7-8 breathing technique was developed and popularized by Dr. Andrew Weil, a physician and researcher at the University of Arizona, based on pranayama techniques from Indian yoga. The pattern is simple: inhale through the nose for 4 seconds, hold the breath for 7 seconds, and exhale slowly through the mouth for 8 seconds. This prolonged exhalation is the heart of the technique. Studies on heart rate variability show that breathing patterns with a longer exhalation than inhalation consistently activate vagal tone and reduce the activity of the sympathetic nervous system, the one responsible for stress, vascular tension, and elevated blood pressure. In practical terms, this means that practicing this breathing regularly can contribute to measurable drops in both systolic and diastolic blood pressure over the course of weeks. To perform it correctly, sit in a comfortable position with the spine upright or lie down. Rest the tip of your tongue behind your upper front teeth, as Dr. Weil instructs, and keep it there throughout the entire cycle. Inhale through the nose silently, counting mentally to 4. Hold the breath, counting to 7. Then exhale completely through the mouth, making a soft sound, counting to 8. This completes one cycle. The main errors to avoid are forcing the retention to the point of creating tension in the face and neck, shortening the exhalation because it feels too long, and performing the technique at an accelerated pace without respecting the count. The recommended number of cycles for beginners is 4 consecutive cycles, twice a day, preferably in the morning upon waking and at night before sleeping. Over time, you can progress to 8 cycles per session. The most relevant contraindication is for people with chronic obstructive pulmonary disease or moderate to severe asthma, as prolonged breath retention can cause respiratory discomfort. In these cases, the technique can be adapted by reducing the retention time or simply practicing the prolonged exhalation without the breath hold phase. If you enjoyed this and want to discover another exercise widely practiced in communities across Asia to make up for years of neglecting your own body, we have a video appearing on screen right now showing each of them in greater detail. Be sure to check it out. Thank you for watching all the way through, and may God bless you, my friend.